Hello and welcome to this update from Thunder Bay Regional Health Sciences Center. My name is Tracy Smith and I am here with Jean Bartkowiak, who is President and CEO of our hospital and CEO of our Health Sciences Research Institute. And many of you may already be aware that Jean is retiring as of November 20th. So Jean, when you
Hi,
look
Tracy.
back, hello Jean, welcome to the video. Now, I want to ask you about your time here. And when you think back to nearly 5 years ago when you started here, what attracted you to the opportunity to be the president and CEO of our hospital and health research institute here?
Well, I had been kind of semi-retired for a little while, but ran into trouble, broke my neck, and ended up in rehab for a year. So my wife wasn't too keen on letting me do my things alone at home. I was a risk factor to her. And then I got the call from the people recruiting for Thunder Bay Regional. And I thought, well, that's an interesting challenge. I knew the former CEO, André, who was a classmate of my wife when they were in university. She too had reached out to me. And Thunder Bay was a known city because I had traveled in and out of Thunder Bay for several trips when I was the CEO at Briere Continuing Care. So me and Tracy Buckler knew each other very well. My wife has had a sister here in town, so she wanted to rekindle with her young sister, Therese. She was about to retire too, so there were all sorts of nice stars aligning for that position.
Absolutely, it seems serendipitous. So I'm glad your wife pushed you to pursue this opportunity. And here we are 5 years later. Can you think back to what your initial impressions were when you first set foot here in our hospital?
Well, first I was just thrown aback by the size and the quality of the architecture of the building. It was outstanding, but most of all, the welcoming of all the staff that I encountered on that first December visit. PFAs, I remember having a chat with PFA in the renal department, and also the board chair who was here to guide me in the hospital and help me navigate the confluence of the hospital, but definitely I was completely reassured that I had made the right decision by coming here.
So the impact of those interactions seems to have really struck you because you made it a priority to continue to engage with staff and physicians, volunteers, patient family advisors. Why did you make that a priority?
Because they're the ones that are closest to our patients. They are the ones who hear about their concerns, their issues, and they also have ideas that we don't necessarily have. So I have to listen and trust that they have ideas that can actually support them in addressing our patients and their families and you know the people that they're caring for.
You also spent a lot of time engaging with your colleagues and counterparts across Northwestern Ontario. Why was that important to you?
Well, partly because of the experience I had in spending a year in a small hospital, dealing with a larger hospital and seeing how the larger hospital was not actually supporting the small hospital. Also, I had been told by one of my friend who was the CEO of one of the small hospitals that we were regional only in name, that we were not really acting as a regional hospital, especially recognizing that the hospital, the general hospital, can actually or needs sometimes to let go some of the work that's being done here because it doesn't need the specialized environment of this hospital. So how can we support the smaller hospitals so that those small hospitals that are not as busy as us can actually be busier and provide the services that don't necessarily need the ultra-specialized environment of Thunder Bay Regional.
Well, and there has been a lot of change as a result of that attitude and those conversations. Do you want to talk a little bit about even just some of the successes that we've seen recently in terms of regional services?
Yeah, so for instance, orthopedic surgery is one big success that we developed for the last 3 or 4 years, where our orthopedic surgeons actually go out in those hospitals and provide hip and knee surgeries. Now that has been expanded to urology, for instance. We're looking at endoscopy for that kind of service. We're also supporting the small hospitals with pharmacy services. Not all the small hospitals, but some don't have the size, the capacity to actually provide pharmacy services. So we are supporting those hospitals with our pharmacists. There are like the regional RCCR, regional
Critical care
critical
response.
care response program. So that has increased, improved, and now we're looking at how could we expand with mental health and pediatrics population as well. So that those will eventually develop in the future. We also looked at mental health. How can we support the smaller mental health program in Kenora, for instance? So we have our fingers in many different spots. We also are involved in purchasing with the Northern Supply Chain program, for instance. So it's not just clinical, it's also back office supports.
So it's really had an impact these past few years on our role as a regional hospital.
Yes, so much so that the small hospitals had the Health Alliance that they were financing and had created to have their own support, decision making, project management support. They came to Thunder Bay Regional and asked that this be included. So they let go of the Health Alliance, and now Thunder Bay Regional has that responsibility. They also agreed to fund the recruitment and creation of a new portfolio. The Executive Vice President of Transformation and Integration, who has been hired a few months ago, it's going to be almost a year this winter, who is actually entirely financed through the small hospitals funding that position, and the VP is actually their voice at the senior team, at the board. She also helped create a new standing committee of the board that will oversee regional services. So that will be made up of representatives from the boards of directors of the small hospitals in the region. So I think this was the way to ensure that their voice was always taken into consideration whenever we were planning changes, projects, and whatnot.
That's quite an impact, and I can feel your pride. And I'm wondering, what are some of the other accomplishments that you are proud of in terms of your tenure as both President and CEO of the hospital and CEO of the Health Research Institute?
Well, in the hospital, I think I've built a fantastic senior leadership team. They're very innovative and open and collegial in their attitude. So I feel very fortunate to have been able to attract such a fantastic team of senior leaders. From the board's perspective, I have an outstanding board that's very supportive of my team and my role, especially in this pandemic situation. They've been very understanding and supportive. I'm very proud of the trust that I've been able to developed with my peers in the region, especially. I know that I was starting here with a lot of doubts about the position Thunder Bay Regional could achieve as a true regional health facility. I think we're way past that, and now we're all looking together at how can we improve our respective performance, improving access to clinical care and specialized care as much as possible closer to home. Internally, we're still facing challenges. We've had to deal with all sorts of demands for the assessment center, for instance, the transitional care unit, because we were swamped with cases of patients. But overall, the staff have been very understanding, supportive. I'm very proud to have been able to lead a team of such dedicated staff that are looking at patients first and supporting their care partners in providing what's best for them in the best environment as possible. So if you no longer require acute care, we have options now that we can offer. But the flip side of it is it's created demands on staffing that is difficult to address. And I appreciate that staff are sometimes exhausted. So we have to always keep that in mind.
Well, I think another feather in your cap that we don't want to ignore is accreditation with commendation that was achieved under your tenure, and that 98.4% rate.
Yeah, I was very impressed by how the team actually prepared, and I mean team very broadly, because surveyors go everywhere they please. I've been a surveyor for many years, so I know a little bit about the drill. So in my short tenure, from my appointment till the visit, the survey, we were able to actually engage and prepare and ensure that we were compliant with the required organizational practices, the standards, and the criteria that are used to determine whether we meet the accreditation standards for that level of accreditation.
Well, thank you for everything that you have accomplished in the years that you've been here. I wonder if you have...
Well, I'd like to thank all those who've supported me, from the board to senior leadership to the leaders and the staff that have always been so welcoming and charming whenever I would show up, including in the region as well, with my peer CEOs and their board chairs and their chiefs of staff that I met during my regional tours.
Do you have parting words for the community?
Yes, wash your hands. Stay physically distant. Wear your masks. We need you in good health, and those are the best protections, guarantees against COVID, the COVID-19. For my staff, I think you have an outstanding new leader that's coming to take my place, and she'll be supported by an outstanding senior leadership team. So take good care of them. You know, they will make mistakes, and that's okay. That's how you learn. You learn from your mistakes. Don't forget that. We have a tendency to forget that mistakes are okay, if they're not intentional, obviously. Yeah, those are the things that come to mind right off the bat.
Thank you so much, Jean, for your parting words and for your leadership over the course of these years. It's been a wonderful experience. Speaking on behalf of everyone at the senior leadership team and on behalf of the community, the impact that you've had is felt by all. Thank you.
Thank you, Tracy. Thank you.